So, hello and welcome to Heart for Your Matters Ask the Expert. I'm Maggie Simpson, a Heart for Your nurse from Scotland, and I'm delighted to be joined today by Associate Professor Luke Burchell, a cardiologist leading the Heart for Your and Adult Congenital Heart Disease Service at the Mayo Clinic in Minnesota, and he's also the president of the International Society for Adult Congenital Heart Disease. So, Luke, thank you so much for joining us today.
Thank you, Maggie. It's wonderful to be here with you.
Thank you. So I guess a good place to start is just explaining to the audience what is meant by congenital heart disease.
Sure. So congenital heart disease describes any condition that we are born with that is related to the heart. And it can involve a lot of different combinations and permutations. I think like the general public would relate to something like a hole in the heart. That might be a common thing that people have heard of. Or they might know someone who has a difference in one of their valves, like a bicuspid aortic valve, which is one of the most common conditions we see. But then we've got much more complex conditions. So things like tetralogy of Fallot, right up to patients who have their ventricles switched or their great vessels switched. And we're talking about transposition patients, or even patients who are born with such complex congenital heart disease that they end up with a surgery called the Fontan operation. And that really leaves them with a single ventricle circulation. So these are our patients who we see after the Fontan operation. So we see this really broad spectrum of people that were born with cardiac defects. Some of them were actually diagnosed even while they were still in utero in their mum's tummy, and we see them for their lifelong care.
Thank you. So what is heart failure, and is heart failure common in patients with congenital heart disease?
Heart failure is very common in our patient community. We would say 20 to 30% of our patients, unfortunately, will develop some kind of heart failure. What is it? How do we define it? In the acquired heart failure world, it's sort of really been a tale of two kinds of failing hearts. It's the heart failure with a reduced pump strength or reduced ejection fraction, and the heart failure that has a preserved ejection fraction. We might call that sort of the stiff heart or heart failure with preserved ejection fraction. So HFrEF and HFpEF. But in congenital heart disease, we have to change the script completely because we're seeing patients with a much broader range and many different kinds of heart failure. But I like to keep it simple and just say it's a condition where the heart is not able to keep up with the body's demands, sometimes without an increase in pressures inside the heart that lead to symptoms.
Thank you. So what are some of the causes of heart failure in people who have congenital heart disease?
For most of our patients, it is those residual anatomic or hemodynamic problems related to their congenital heart disease. And we can think of them broadly as sort of a pressure overload or a volume overload for whatever reason. So often when we see our patients, our first step is to undertake a proper hemodynamic assessment, both non-invasive or invasive for some patients. We're really looking for something that we can target that's anatomic or hemodynamic. There are some patients that have developed other complications, rhythm problems being especially common in more than a third of our patients. Sometimes we want to target those. And other patients have developed complications like pulmonary hypertension associated with their heart failure that needs to be understood and treated. So again, it's a very diverse range of causes, and we need to, I think in most cases, go back. What's their anatomy? What were their surgeries? And what are their residual defects or deficits within the heart that we can treat?